This is Smooth 98.1. Love music, love life. It's a beautiful Thursday morning on the Smooth Breakfast. Yours truly is Ayokunmi. We're about to have a conversation, get into a back and forth, and have a dialogue. Let's talk Lagos. This is Lagos Talks. Welcome along to the journey with us. And we're looking forward to you sharing your thoughts, experiences, and of course, any questions that you might have, because it's all about awareness this morning. We're going to be talking about stroke. Yes, that is a sensitive but very important discussion that we need to have. It's off the back of World Stroke Day, which came up on Tuesday. That was the 29th of October, 2024. So that is what we're bringing to the fore, from awareness to action, preventing stroke together. Joining me this morning to talk about this is Dr. Lilian Ochayi. She is a public health physician. Very good morning to you, Dr. Lilian. It's been a minute. Great to
Hi.
have you back.
Yeah, good morning, Naya. Thank you so much for having me.
It's an absolute pleasure, talking about these issues, bringing awareness, and of course, education. It is very, very key when we talk about preventing them and, of course, living healthier and fuller lives as well. So, you can join the conversation this morning by sharing those thoughts with us. Any questions you might also have, because this is an opportunity for you to get some questions that you might have answered, some things that are confusing as well. Dr. Didi will do her best to answer those questions and give you the much needed clarity as well. So WhatsApp is one way you can join us. It's 0809 444 0981. 0809 444 0981. You can send your messages there. You can also call on that number as well. If you can't get through on the studio line, which is 0201 4489 981. 0201 4489 981. YouTube, we're also streaming live. That's another way to get across to us. We're at Smooth 981 FM Lagos. You can also drop your comments there. And of course, I'll take them as the show gets along. Okay, so just to set the scene here, to give us a better understanding of where we are and where we are going through, talking about strokes, which are also known as cerebrovascular accidents. They're a leading cause of death and disability worldwide. Now, globally, nearly 15 million people suffer a stroke each year, and 5.5 million of those cases result in death. And for survivors of this, the journey to recovery can be challenging due to physical, emotional, and economic impacts as well. And talking about right here in Nigeria, the stroke is increasingly prevalent, partly due to lifestyle changes, rising rates of hypertension, and limited access to healthcare services as well. Now, the theme for this year is hashtag greater than stroke. Now, it urges us to transcend awareness by taking concrete actions toward prevention, treatment, and support as well. These are very, very key things. And, Dr. Lillian, let me just get into it straight off, right off the bat. We need to understand what it is we're talking about. So, can you explain to our listeners exactly what a stroke is and how it affects the human body?
All right, thank you very much for that, Ayo. Stroke affects the brain, and we know that the brain controls our movements, stores our memories, is a
That's right.
source of our thoughts, emotions, language, so it controls many functions of the body, including breathing, digestion, and so on. So the brain, like all parts of the body, needs oxygen to work properly. And it gets this oxygen from the blood, right? So your
Right.
arteries deliver oxygen-rich blood to all parts of the brain. And so a stroke happens if something happens to block or interrupts this blood flow to the brain. The brain cells of the affected area where this blockage has occurred start to die within minutes because they can't
Oh,
get
wow.
oxygen. Yes. So this is basically what a stroke is, when there's an interruption in oxygen supply to the brain. And it's just like we can picture this as a pipe, right? That water flows through, but here we have the blood flowing through. So if something blocks the pipe, or for some other reason the pipe bursts open, There won't be a normal flow of blood. And so this is what causes a stroke. And there are two main types, the ischemic and the hemorrhagic. So like I just explained, if there's a blockage, like a blood clot, built up from accumulation of fats like plaques, things that just tend to clog up the arteries, or when something happens and the blood vessels just, burst open and then there's bleeding everywhere in the brain. So these are the two main types of stroke that usually occur.
Just hearing bleeding in the brain, it's painting such a very, very scary picture in my mind. Just thinking about that cannot be a good thing by any stretch of the imagination, really.
Yeah.
And let's look at a couple of numbers here before we segue into the risk factors. I mean, worldwide, stroke is the second leading cause of death. Now, in Nigeria, it's estimated that strokes affect up to 200,000 individuals annually, with around 80% of cases linked to hypertension. Because usually we hear, oh, someone who had a stroke more often than not had a case of hypertension. So they kind of work hand in hand, for want of a better way to put this. Now, knowing these figures, it's very crucial to understand those risk factors and how we can manage them effectively, which leads me to asking you, Dr. Lilian, what are some of the common risk factors for stroke in Nigeria, and why is it very prevalent over here?
Right, thank you for that, Aya. So the risk factors are practically the same everywhere, but being a Nigerian, we also have our predispositions. The fact that we're Black alone already puts us at risk. For some reason, Blacks are at a higher risk of, being in this group, like hypertensive and, coming down with stroke. Yeah, so that's one risk itself. And then age also is another. So speaking to risk factors, there's the way we talk about them. There's the non-modifiable and there's the modifiable ones. So for non-modifiable, those are the ones that you have no control over, basically. So being Black, I mean, there's nothing you can do about that, right? So, and then the age. For the age, anyone can have a stroke. Even babies have strokes.
Babies have strokes.
Yes. Children have stroke,
wow.
But it's predominant among the elderly, right? Because hypertension is like one of the major causes of stroke, basically. But from the older one gets, the higher the risk of also coming down with a stroke. So that's another non-modifiable risk factor. Then men also are at a higher risk compared to females. And then family history. Yeah. Family history. So being in a family where, there's your parents are hypertensive or diabetic or some of those issues also can put someone at risk. Then coming to the modifiable risk factors, these are the ones that we can control, we can manage, right? So hypertension is the number one risk factor. So people that are hypertensive, that are not managing or controlling their blood pressure well enough, are at a very high risk. Smoking is another risk factor. It's among hypertension and smoking actually are the top two risk factors.
It seems like smoking is always mentioned a lot in a number of these ailments.
Yes, they are. It's actually something that actually affects these vessels and everything. And this is where, like I mentioned earlier, this blood passes through, and if they are damaged, a lot would go wrong in the body. So another is being diabetic and not controlling the blood sugar well also can be a risk factor. High cholesterol fats, not controlling your fat levels. Obesity is another one.
Mm.
Okay. And also I mentioned smoking and also some exposure to air pollution. If someone is exposed to air pollution for a long period of time too, it can also clog up your arteries and things like that cause issues.
Okay.
So these are main risk factors that predispose people to having stroke.
Okay, interesting there. So we actually need to take a break now, but before we do that, I just need to clarify this. So looking at the modifiable factors there, so
Yeah.
as long as those are handled well and those are kept in check, they have a very strong effect over the non-modifiable ones, correct?
Yes. So
Okay.
so someone with the non-modifiable risk already should watch out for these things and work towards making sure that they are all within normal levels, and then
Right.
preventing and stopping some of these habits that can cause stroke. Yeah.
All right, let's take a quick break right now. When we come back, we'll begin to talk about the importance of early detection and what is known as the FAST, the FAST method. To find out more about that, keep it tuned to Lagos Talks right here on Smooth 98.1. Okay, first break of the day.
How long?
It's about a minute.
Okay.
I'm gonna drink water. I'm parched. I'll be back.
Yeah.
West Africa's leading international art fair, Artex Lagos, returns for its ninth edition, coming to the Federal Palace, Victoria Island from the 31st of October to the 3rd of November. Artex Lagos is more than an art fair. It's a gathering place for our community. Join us on a journey of discovery through African art, culture, and creativity. Get your tickets on artexlagos.com now. Artex Lagos is proudly sponsored by Access Holdings, Affection Bank, Stanley IBTC Culture Management, Apple Milton, NBA app, and Jet Temple, Trace TV, Soothe FM, and Beat FM. Hometown greatest hits from as far back as the 70s. Temptation, Gloria Gaynor, Gladys Knight, Gladys. Enjoy the sweet collection and blend of Motown greatest hits on your radio. Motown Monday, every Monday from 11 a.m.
Welcome back to Lagos Talks on Smooth 98.1. Love music, love life. 17 minutes past 9 a.m. It's a Thursday morning. Ayokunmi here. And we are talking about stroke. It's all about stroke awareness. Tuesday was the day, but it is not too late to have this conversation. We're talking about going from awareness to action, preventing stroke together. It's all about prevention. Preventing a lot of things can save us a world of trouble down the road. My guest this morning is Dr. Lilian Ochayi. She is a public health physician, and she is helping us to better understand what strokes are and, of course, how we can avoid them altogether. This is an interactive session. It's also a session for you to get some well and needed information, knowledge as well. If you've had any issues concerning this, anything you'd love to know or to clarify, this is that opportunity for you to do so. So all you need to do is send your messages in on WhatsApp. That's one way. 0809-444-0981 is the WhatsApp number. You can send messages there. You can also call on that number. Yes, another opportunity. The studio line is 0201 4489981. 0201 4489981. That is the studio line. If you'd love to join us on YouTube, you can do that. It's Smooth 981 FM Lagos, Smooth 981 FM Lagos. You can also leave a comment there, a question that you might have, and I'll definitely take it. Call coming in. Let's take this one. Hello, good morning.
Good morning.
Very good morning to you. Welcome, Frank.
Yeah, actually, just I was interested in the topic. Something that's always giving me some concern.
Okay.
The issue of blood thinner, like aspirin and some other like that.
Okay.
They are supposed to be okay. From what I got, they're supposed to be quite good. But they also have their own problems. Like if one is not careful, it can start having blood. What do you call it? If you have an injury, it could escalate the blood flow.
Oh, okay. Yeah. Okay. Clotting won't happen.
One, especially
All right. Thank you for that question, Frank. I hope you got that, Dr. Lilian. Frank talking about blood thinners.
Okay.
So he actually wants to know how if it's something that should be used on a regular. I mean, what's the benefit, and if it's something that one should be very careful about, especially where hypertension is concerned.
Okay. Thank you very much for that, Frank. So speaking to this is he's asking for someone that has had a stroke or not yet.
No, I think no, not yet. Not
yet. Okay. So yes, but no person should be on medications without a doctor prescribing them. And if the person is hypertensive, usually you're supposed to be on medications like for the rest of your life, right? And it's something that is being managed continuously. So there's need for continuous checkups, follow-ups in the hospital. The doctor checks blood pressures regularly to see, how well it's controlled. And in some cases, if there's a high risk of, from investigations done, they notice that there's a risk of stroke, patients can actually, yes, be given blood thinners to prevent a stroke from happening, but it should not be taken by, by the patient just without, a doctor's, overseeing
prescribing,
or,
right?
Yes,
right.
Prescribing and following up continuously. So this is where the danger comes in. So it must be prescribed, and there must be consistent follow-up with the patient.
Okay.
But
all
yes,
right.
they are actually very important. Same for, like I said, for hypertension. Patients have to be on medications for the rest of their life usually, and even those that when they have a stroke, they're also giving medications to prevent strokes continuously for the rest of their life also. So these medications are very important.
So after one has suffered a stroke, subsequent strokes can also be suffered.
Yes,
basically.
Yes. Yes, there's even a higher risk of having another stroke after, just having one. So yeah, there has to be medications the person should be placed on to prevent further strokes.
Man, that is such a scary thing. Anyways, we're talking about prevention, and early detection is something that we need to take very seriously. But before we jump into that, let's take another call here. Hello, good morning.
The drug was prescribed, and but I hear people saying, "Don't try it; it's not good." Another doctor saying that, so it's quite confusing. A doctor has prescribed this medication, the blood thinner, not that one has had a stroke or anything, but just as a preventive measure, as part of the treatment of the hypertension. But another doctor says, "Look, don't do it; it's bad; it can kill you and all that." So that's
Oh, okay. Thank you for that clarification, Frank. Okay, Dr. Lilian, Frank is saying that it was prescribed by a doctor, but another
Yeah.
doctor saying that, don't use it, is bad. I mean, there's now a conflicting thoughts. His doctor prescribed it for him to use. Another doctor says, no, it's bad. I mean, why why the yes on this side, the no on this side? Because that's what's confusing him along the
Okay.
line.
Okay, I get. Okay, fine. So this is actually a confusing situation because we're like, okay, go to the doctor, and then this doctor is saying this, another is saying that. So I don't know, but the thing is actually for depending on, so every person's case is peculiar, right? So I would not be able to say exactly what the issue is here with this particular patient, because there would have been investigations and things that would have been done before medications were prescribed. But I would just recommend that maybe so I don't know whether it's private clinics or where that the person went to. So maybe getting another opinion from a teaching hospital, or somewhere where government owned or something like that would be better for better clarity. So that's what I would advise.
Okay, so that being said, I mean, looking at this from a general point of view, I mean, one has a doctor that he or she goes to. That doctor has a medical history. That doctor knows everything from the ground to that point. Now, isn't that doctor in the most, should I say, informed place to decide what medication is good or bad for that particular person at that point in time? I mean, the doctor has already seen you, has known your history, and is the one with you at that point in time. So isn't that the best person to decide, this medication is good for you or not good for you, as opposed to another doctor saying something else? We don't know if the other doctor has actually looked at him to start with, or has actually had a conversation or examined him. We don't know that, but
yeah, exactly.
I mean,
That's why I said I would not be able to say exactly, because I also have not examined or seen any investigations from this person. But still, there's still nothing wrong in getting a second opinion, right? So if there's conflicting information someplace, you can get it, from a teaching hospital, just like I said.
all right. Okay,
Yeah.
let's talk about prevention, because that is one very surefire way of ensuring that one does not fall victim to a stroke along the line, especially for those who already deal with hypertension. Of course, they work hand in hand. And we know that recognizing stroke symptoms early can significantly reduce the long-term impacts. I mentioned the FASD, that's the FAST method. That's face drooping, arm weakness, speech difficulty, time to call for help. Now, it has been proven effective for quick identification. Now, could you talk us through what this method actually is and how crucial early detection can be when it comes to managing or preventing a stroke?
Yes, thank you for that, Ayo. So, earlier when I was talking about what stroke is, I mentioned that every second, millions of the brain cells die. So when there's interrupted blood flow to the brain, it affects these brain cells. So the quicker, the better. Time is really of the essence when it comes to stroke management. And the outcome usually is a lot better if the patient is attended to in time. So this FAST method is just a way for people at home, once they start to notice these things, to get help immediately. So it's an acronym. F means face drooping. So if you're noticing that there's facial asymmetry, maybe the face is dropping on one side, or you try to smile and then it's not like a full complete smile, and it's falling on one side.
On one side.
Yes, so that's what the F means. The A is for arms. So if there's weakness in the arms, maybe one side or the other side, or also in the legs, and you can't lift them, that's the second sign. Then S is for speech difficulty. So if you're finding it difficult to say things, or your speech is slurred, that's another sign. Then T it means it's time to call an ambulance. So basically that's what the fast method is about. So when you notice those signs, you call an ambulance, and then, or you call any family person around or whoever to help get you to a hospital as quick as possible. So yeah.
As quickly as possible. Time is definitely of the essence, and it's actually quite telling that the acronym is FAST, F-A-S-T. Right. Okay, we'll talk about preventive measures and, of course, lifestyle, because lifestyle definitely plays a part in preventing a stroke from happening. We'll talk about that on the other side of a quick breather right here. This is Lagos Talks on Smooth 98.1. Go anywhere, keep it tuned. I didn't know babies could have strokes. How can babies have strokes? How?
They do. In fact, less than 1 year. There could be like maybe a blood clot from the placenta just go straight to their brain. Stuff like that. Yeah, they do have. And then sickle cell kids too. They also tend to have strokes from time to time, some of them. They have issues with their blood cells already.
Yeah.
So it could just, the same way they have crisis where the vessels are clogged and they start feeling pain. So the vessels could also get clogged in the brain and then cause a stroke.
Right.
Yeah.
There's a message here. Let me read it to you before we go back on air. Can sciatica pain lead to stroke?
Sciatica, that's muscle now.
Is it muscle? I thought it was nerves.
What did he say again?
Can sciatica pain lead to stroke?
Nerve, yeah. Okay. Can it lead to stroke?
Yeah, that's the question.
That's just pain now. It wouldn't. Stroke is mainly about blood vessels.
Oh, okay. So sciatica is okay. Well, nerves different from blood.
Yeah.
Okay.
Yeah.
Okay, so I'll take the question when we come back in, so you can give him a response.
All right.
Welcome into the second half of Lagos Talks on a Thursday morning right here on the Smooth Breakfast on Smooth 98.1. The music, love life, love conversation as well. Ayokunmi here. Alongside me is my very special guest this morning, Dr. Lilian Ochayi. She's a public health physician, and we are looking at preventing stroke together off the back of World Stroke Day, which came up on Tuesday, the 29th of October, 2024. We have been talking about what stroke is, what to look out for, and we'll soon be talking about how to prevent. Prevention, they say, is better than cure. You can also ask any question that you'd love to get answered this morning, or any observations that you might have, anything concerning concerning strokes that you'd love to get answers. This is the place for you to actually do that. And you can send messages in on WhatsApp on 0809 444 0981. 0809 444 0981. That is the WhatsApp number. Now it's a two-pronged approach on WhatsApp. You can send messages there, or you can give us a call as well on that platform. Now, if you'd love to give us a call on the studio line, the number remains 0201 4489981. 0201 4489981. That is the studio line. We're also streaming on YouTube, where you can catch us at Smooth 981 FM Lagos. Smooth 981 FM Lagos. That is on YouTube. You can also drop a comment there, and I will definitely take it as we get along. And Dr. Lilian is going to answer your questions and give you the much needed clarity that you need. Technical hitches wanting to ruin our party, but no, it's not going to happen. Dr. Lilian is back. And okay, it's a back and forth sort of thing. We'll do everything to get her back on board as soon as possible. I see a couple of messages here from Austin and Peju as well. We'll take them along the line. Dr. Lilian, are you back with us right now, or is it still a rally
Hi,
tennis?
sorry.
Sorry. Okay, you're back. Fantastic. Thank you.
Yeah.
Thank you for making it back. And I thought the gremlins were going to get into getting in our midst and not allow this conversation to actually come to a conclusion, because there are questions for you on WhatsApp.
Okay.
Let me take the first one from Austin. Austin says, please, can sciatica pain lead to a stroke? That's Austin's question.
Okay. Usually sciatica is not a direct cause of stroke, and that is mostly about on the nerves, right? And stroke is basically with the vessels being clogged or bursting and stuff. But there's somehow some increased risk, with patients that have sciatica having stroke, but the link is not really direct and it can't really be explained particularly right now, but it is not a direct cause of stroke.
Okay.
Yeah.
But still it's something that Austin probably should talk to his medical practitioner about, just to be on the safe side, right?
Yeah, but there's a link. There's an increased risk of having stroke in patients that have that, but it's not a direct link. So yes, it's still something to be cautious about.
All right. Okay, another question here. This is from Peju. Peju says, how fast should the progression of the symptoms mentioned in the FAST and the FAST acronym be to know it's time to seek medical intervention? Is it minutes, is it hours, or is it days?
Oh, wow. Okay, thank you for that. So this thing, it could happen in minutes, right? It could happen like really fast. So if, for instance, there's stoppage in blood flow, these things could just happen. Like it could happen like with, yes, immediately. Like it could start with the face droop, it could be the arms, it could be the legs, So the minute a person notices these things, before it starts to progress, it's, you have to immediately call for help and get to hospital as fast as possible. So waiting the next day and all that could just prolong and make management even, not as well as it should be, because, like I said, the earlier, the better. And the longer it takes, the more damage is done to the brain cells. So it makes it more difficult for full recovery to happen.
Okay. So basically, as soon as one sees any of these particular symptoms mentioned, in the FAST acronym, that's a face drooping, arm weakness, one needs to move
immediately. There's another type of stroke. It's known as TIA, transient ischemic attack. It's all the symptoms come and they resolve in less than 24 hours. It's not particularly a stroke yet, but it's like a warning sign that a stroke might happen soon. So even in that case, even if the symptoms resolve in some cases less than 24 in less than 24 hours, the person should still go to the hospital, because you need to be on medications to prevent a stroke from actually occurring. So that's basically,
All right. Movement as soon as one notices any of those symptoms.
Right.
You can't wait. You can't think, okay, it's going to take a while. Immediately seek medical attention. That is the thing. Okay, so now we've established all of this, and we begin to wonder, how exactly can we avoid getting into this or falling into this this situation where a stroke is concerned? Let's talk about lifestyle changes, because when you talked earlier about some of the causes here, you mentioned lifestyle, smoking came to play as well, obesity as well. Some of these things that also, unknowingly so, can lead to other ailments as well. Talk about diabetes and so on and so forth. It's so scary how they all work hand in hand, down the road. Now, that being said, what are some practical steps that individuals can actually take to reduce their stroke risk, particularly in high-risk populations, the Black people for one, and those who already have hypertension to start with?
Yeah. So number one thing is to be more active, right? Physical activity. It's very important. And this, the World Stroke Day that was just celebrated on the 29th was also speaking particularly to this aspect of, prevention. So exercise, at least 150 minutes a week, maybe 30 minutes alternate days. If it's jogging, walking, running, hiking, whatever form of physical activity one can engage in, it's very important to do something every day. So that would reduce the risk of having a stroke. Then eating healthy, greens, fruits, less salt, less fats, less oil, and all those things will definitely reduce the risk. Controlling blood pressure, those that are already hypertensive, being on their medications, being regular on their medications.
Thank you for saying that. Being regular.
Yes, being compliant, because some you can just take sometimes. Then again, still, as you're taking your medications, it's important to monitor your blood pressure so that it doesn't get to the point where you're now becoming hypotensive. And this is where follow-ups are very important. So it's still good to go have appointments with your doctor and keep going. They might need to change the medications at different times. They might need to increase or reduce the dose based on how your blood pressure is at the time. So it's important to constantly follow up on this. Then we already talked about diabetic control, managing your blood sugar, smoking, stop smoking, lower cholesterol, fats, lower your fat intake. And then another thing also, for alcohol, it's important to lower your alcohol intake with at least within the recommended limits. We know that a lot of people like to have one or two drinks
every now and then.
But at least the recommended limits for guys, no more than 2 drinks a day. For women, no more than 1 a day. So at least if you can stay within that, it's still okay. And, so basically those are things that we can do to reduce our risk and prevent stroke in this our environment.
All right. Let me take another message here. This is James from Yaba. And James is wondering the role of traditional practitioners come to play, as they have been involved in caring for stroke patients, and there's significant progress in the management. Can you speak to this, Dr. Lilian? I mean, the role of traditional practitioners here.
Okay, yeah, thank you for that. Yes, so they actually have been, and I mean, it's important because when managing stroke, right? Apart from the medical aspects, there's still the part of rehabilitation, right?
Okay.
So for especially those with balance issues, those that have difficulty speaking or with movements, things like that, in their recovery phase, they do need support. They do need, like in our medical world, we would say they need like multidisciplinary, approach of management, like physiotherapists, people
Okay.
that will help with speech, people that would support them, and also other people that from my understanding, in this traditional setting, they also maybe help with those things, in helping them to come back to doing things that they used to do before. But on my end, I'll still say that being on these medications, at least I know that these medications are what will work and what would be, quite effective. But I would not really be able to speak to, what the traditional people would use. But in the aspect of rehabilitation in the community, I think, yes, that everyone does have an important role to play in assisting those in our community, especially with financial challenges that people might face, having to pay
I was gonna
for.
I was going to come there because that is a big issue. But we need to put a pin in that real quick. Take our final break. When we come back in, we'll talk about that, Dr. Dave, the financial aspect. I
All
mean,
right.
knowing where we are now economically and how difficult and how expensive drugs are, what it is
Yeah.
that can be done on that front. Keep it tuned to
Yeah.
Smooth 98.1. We'll be back in a bit. Lagos Talks. Don't go anywhere. All
Well
right.
done.
Oh, thank you. Thank you. It's not beans.
That's
Oh,
one major issue. This finance thing. Everybody wants to go traditional.
because medication now, the cost, hey God,
Yeah,
God have mercy.
as
It is,
in,
it is ridiculous. Completely ridiculous. People are going through a lot too.
seriously. We don't even have enough facilities. Even the ones you have, safe, you will have to pay through your nose.
Imagine.
Hey.
What can you say about your finances? Let's talk about it.
Sorry, oh. You know what happened that time? Somebody was calling me.
Oh, it was not interrupting your
Yeah,
internet.
I kept ending the call, but then the person just kept. I was like, oh God. Like, Aya is going to be like, hey.
I was already wondering what's going on.
Yeah. Say that thing that happened that time.
I was going to bring it up, but I mean, you did yourself. I was going to bring it up. I really wasn't. I thought it, but I didn't want to bring it up. But you decided to do so. No, that day was crazy.
Oh, good.
All right, the final moments on Lagos Talks this Thursday morning on Smooth 98.1. Love music, love life. Ayokunmi here. And we have been talking about stroke this morning, looking at prevention. Yes, preventing stroke together. That is what we are all about this beautiful Thursday morning. Dr. Lilian Ochayi is my guest, and she has been giving us a lot of insight and sharing this knowledge. Very, very important that we take it really seriously, especially for those who are at risk. I mean, we as Black people, we are already at risk. So That is one handicap. And then for those who already have issues with hypertension, you need to take it a lot seriously, a lot seriously. And you can still send a couple of messages in to us on WhatsApp on 0809 444 0981. If you have any questions that you'd love to have answered, you can also give me a call or give us a call on the same number as well. The studio line remains 0201 4489 981. 0201 4489 981. We're streaming on YouTube at Smooth 981 FM Lagos. If you are there watching, you can also drop a comment. I'll take that. And Dr. Lilian will do her best to answer that question. Okay, Dr. Lil, welcome back into the show. We were talking, before we went on that quick breather, we're talking about finances, which are a very big issue when it comes to medication right now.
Right.
It is not easy. It is not easy. So could you just shed some light on the financial challenges that stroke survivors and those who are managing it and their families face right here in Nigeria?
Yeah, thank you. So the medical cost of managing stroke or acute stroke, it's a major burden for patients, especially here in Nigeria, where out-of-pocket payment is like the major source of healthcare financing. And with this, there's mainly high fees that they have to pay for lab investigations, drugs, scans, brain scans. So it's actually is one of the barriers, to accessing treatment here. So even with all the fast and them try to get help on time or get to a hospital in time, this is also one major issue that would prevent people from actually not getting the appropriate care that they need in time, and then costing more issues or disabilities. So it's really something that we need to look into. The government needs to come in and also help find ways to subsidize healthcare for people, and yeah, so it's and this is part of why, like the last person that asked that question, this is why people would want to go the traditional routes, because going to hospitals and all that is quite expensive. Yeah, so these are the issues now, and we're just hoping that with time things get better and people are able to get more access to these services at a subsidized rate.
We are actually hoping and really praying hard that things will work in that direction, because people are definitely going through quite a bit when it comes to getting access to affordable healthcare and of course medication as well. That is usually a big problem for a number of people. Now let's delve quickly into the issue of support, because that is something that anybody who has probably suffered a stroke before would need. Support is definitely at the top of that list, because they are already impaired movement, speech. It's already a big issue for them. Emotional support often determines the quality of recovery, but that is something that tends to be overlooked. Now, how important is support for survivors of stroke, mental health support, emotional support? How important, how key is it for those who suffer this in terms of their recovery? What resources are even available for them here?
Right. Thank you for that. So when we said the brain actually controls a lot of things, right? Your emotions, your thoughts, and body movements, memories, things like that. So when this is affected, it can cause, different things: irritability, forgetfulness, confusion, feelings of fear, frustration, in these patients. They could also have anxiety, depression, some even PTSD. And these are issues that stroke patients face. And in turn, their family has to bear this burden by taking care of them, supporting them, being there, being present. So it requires a lot of effort from the family, from those around them, not being able to move, perform basic functional activities. It's suddenly it's just going to be a lot for the patient to manage at that time. So support is very important. It's very important. And we also so the thing is, like I was saying about rehabilitation, there are rehabilitation centers for stroke should be a priority here. We don't have so many of them, and even the cost, of putting your patient or your family member in one of them would send most people away unless you can afford them. So these are the issues, right? So if patients could also get this, and another way that support could even be given is by this group thing, like being in groups where other stroke patients are also meeting. You can also be able to
Okay.
interact with people that are also experiencing the same thing as you are, and also feel like you're not alone, and you can be able to share your experiences and open up and speak. So mental health support for them is very important, and as family members we should do as much as we can, even though there's with the financial challenges. We should just try as much as possible to be present for those around us that have suffered stroke or are still recovering from this condition. Yeah. So
All right. I mean, very, very well said there. I mean, looking at everything in its entirety, there's a lot that needs to be done. There's support that
yeah,
needs to come from every corner as well. But one thing that we're going to harp on at the end of the day is prevention. And as we round up the discussion, Dr. Lilian, could you just, in about 30 seconds, just wrap it all up for us?
right. Thank you, Aya. So yeah, so we talked about stroke being something that can happen real fast if your blood vessels get clogged up or if there's a burst in the blood vessels. So to prevent this, it is very important to be active. Physical activity, very important. Eat healthy, more vegetables, fruits. If you're hypertensive, take your medications regularly, see your doctor, have follow-up, have checkups regularly, eat healthy. I already mentioned that. Drink less within the recommended, maximum two for guys, maximum one for females. Then stop smoking. These are things that would prevent a risk for stroke among us Nigerians. So yeah, thank you. I think I tried to summarize that.
Yes, indeed, you did. Thank you so much, Dr. Lilian Ochayi, for taking out the time to join me this morning to also spread this very much well-needed knowledge. It's been a pleasure having you on Lagos Talks.
Thank you very much. I had a good time here. Thank you.
Likewise. All right, do have yourself a great Thursday and a stress-free weekend as well.
Yeah.
All right, thank you all for your calls and your messages as well, and for always keeping it tuned to your Love Music, Love Life station, Smooth 98.1. There's more great music coming your way to get you settled in on your Thursday at work, at your place of business, wherever it is that you are. Hey, Smooth 98.1, we've got you.
Ooh. Yay.
And it is